The Affordable Care Act, what you need. Recently, a 30-year-old healthy woman, I'll call her Susan, delivered a healthy baby boy. On the third day after giving birth, Susan developed severe abdominal. Her kidneys were also no longer working. Physicians performed multiple surgeries to save Susan's life. She was able to go home shortly before her baby turned 6 months old. She was on many medications and did not have a doctor. The nurses in my office, including myself, called many practices, including the free clinics, in an attempt to establish care for her with a doctor near her home. Because she had Medicaid, the appointment she received was 4 months away. When she returned to my office for a post-operative checkup, she began to cry. Susan needed her medications refilled, and no one could get her in any sooner. As an advanced practice registered nurse, I discussed this. Healthcare reform, and access to healthcare have been topics of discussion in every home, medical practice, and hospital in the United States since the passage of the Affordable Care Act in 2010. The problem is noted that there is a shortage of primary care providers. The Association of American Medical Colleges estimates that the country will have a shortage of approximately 63,000 primary care physicians by 2015, with this growing to approximately 130,600 by 2025. The answer, many feel, are nurse practitioners. They believe that the nurse practitioner is qualified to step in and fill this gap. However, this leads us to another issue, the scope of practice for nurse practitioners. Nurse practitioners, who are they really? A nurse practitioner is a registered nurse. In addition to a bachelor's degree in the science of nursing, they also hold a master's degree in the science of nursing. They must successfully complete a board certifying exam to practice and must also successfully complete clinical hours in addition to their studies. Advanced practice registered nurses is a broad name. This name also has 4 sub. The issue is back to scope of practice. Currently, no uniform model of practice laws for advanced practice registered nurses exists across the United States. Each state independently determines the legal scope of practice. Currently, 16 states allow independent practice. This means that the nurse practitioner does not have a direct supervising physician. They are practicing alone. 27 states. This lack of uniform practice means that nurse practitioners cannot help fill the current provider shortage nor the one that looms on the horizon. This is a terrible disservice to our patients. This could be an increased wait time. This is the United States with a breakdown of state-by-state regulatory requirements. The dark purple are those that practice independently, the blue are those that practice with direct supervision, and the light blue are those that do not allow prescriptive authority or the ability to write a prescription. Possible solution for this dilemma is to allow advanced practice registered nurses to practice the same across the United States. How can we do this? With the help of the federal government. The federal government has the power to eliminate these differences by mandating a requirement that all states adopt a model. Little support for this was in the May 2010 Health Affairs issue. 19 studies were reviewed and revealed that nurse practitioners developed care equivalent to that of physician-provided care. Some revealed that more effective care was actually delivered by the nurse practitioner. The nurse practitioner also demonstrated better results in key quality measures such as follow-up, patient satisfaction, consultation times, and providing screening, counseling, and assessment. A little more support would be the Medicare savings estimates. If advanced practice registered nurses were utilized in 1 year, as an example of 2011, $6.3 million would have been saved. If they had been utilized for a 10-year period, such as 2011 through 2020, $273.1 million would have been saved. With the Additional benefits of eliminating differences among the states: it facilitates the mobility of the advanced practice registered nurse. If the nurse practitioner is to move from one state to another for whatever reason, her husband got transferred, his wife was transferred, and they had to move, there would be no technical border around the state that would stop that nurse practitioner from practicing the way they were in one state versus how they would in their new state. This also ensures public safety. This means that all nurse practitioners will be able to provide prescriptions, all nurse practitioners will be able to see patients and treat them and help move them along in the system. Please make no mistake. Nurse practitioners do not intend to take the place of a doctor. When utilized as part of a multidisciplinary care team, we can all provide quality, improved access to care, especially during the shortage of doctors. Many of us work under the direct supervision of a physician. So why does this matter to you? You and the American public deserve a more uniform approach to practice, which is needed and very necessary, especially in light of the primary care physician shortage that is looming. If the federal government eliminates these barriers to practice, we can increase access to care and see more patients on a timely basis. Physicians and patients are all feeling the effects of the doctor shortage, and this will only worsen with the implementation of healthcare reform. No one should have to experience what Susan did. What will you do if you or